Thank you, Chairman, and welcome to both of our nominees. Thank you very much for your service as a parole officer. I was U.S. Attorney and worked with our parole officers very closely, and it's a terrific responsibility, and thank you for the years you've spent in that particular service. I want to ask you one thing about the opioid epidemic that is ravaging Rhode Island and many other states. In particular, what we are seeing is babies born opioid dependent. In some cases, the mom is doing everything right. She's in recovery. She's getting medication-assisted treatment, and that medication puts the baby in the same position when born of being opioid dependent. And in order to solve that problem, we're finding through particularly Women and Infants Hospital, which is a very excellent leadership OBGYN hospital in Rhode Island, that you really need to look at the social determinants around that family and engage with the mom in a way that brings in a lot of other supports. And if you can do that, you can bring down the time spent in the hospital, you can improve outcomes, but it does take pulling a lot of things together. Is this an area that you would be interested in supporting through the various programs that you will oversee?
Thank you, Senator Whitehouse. Absolutely. I think my strength is pulling community resources together, whether it's in my own agency or in the community, to wrap around a person-centered practice, working with the family, the parent, and the child at the same time, and the safety supports that wrap around them, especially with addiction. It's not an easy thing to conquer, and so I would commit to working on this to enhance practices, but also to look throughout the country to find where are the services for these individuals, are there enough substance abuse treatment practices that are successful, and then how do we best take care of the children?
Perhaps we could even get you to Rhode Island to visit Women and Infants Hospital and see their program. I will extend you that invitation.
That would be an honor. Thank you.
Mr. Bartrum, I have some favorite graphs that I spend a lot of time thinking about, and this is one that shows the projected costs of federal health care expenditures. This top line is the red line here, and back here in 2010 is where this red line estimate was generated, and that was the predicted cost of federal health care out through those years. They came back again here and redid it. This is CBO work, and redid their graph based on a different experience than had been predicted, and then they predicted going forward. In addition to being on the Finance Committee, I'm on the Budget Committee, and in the Budget Committee we do our work in 10-year increments. So here is a 10-year increment from 2018 to 2027. And in that period, whatever happened that caused this departure from that projection has saved us $3.3 trillion in federal health care spending. I didn't see benefit cuts in that period. What I've seen is things like our provider ACO, Coastal Medical, taking advantage of the ACO provisions of the Affordable Care Act to drive costs per patient down $700 on average per year. And they started below average to begin with, so this isn't like those McCollum, Texas pirates, nobody here from Texas, I hope, who were overcharging like crazy. This was a more efficient than average practice. And what I would like you to pledge to me is that you will help me understand why that took place. You will help me understand what the department believes, what its experts and the people who do these kind of projections believe might explain how we reduced anticipated federal health care costs by $3.3 trillion over 10 years without cutting benefits. Because if we can do that inadvertently, it's something I'd like to do deliberately. Will you pledge that you'll work with me to help understand why this took place?
Senator, I certainly would pledge to work with you, and I would appreciate the opportunity to work with you and understand your details more, because I think that you and I would both agree that the cost of health care is not affordable, and that we need to make sure that we have affordable and we have access to care, and that people have the ability to get the types of care when and where they need it. And I would suggest that we probably also agree that there probably needs to be some changes to how the system operates and the way the modern operation of the world goes. I mean, think about years ago how
fee for service
we
should be rid of.
Yeah, just think about how technology has changed how you make your travel reservations. You used to use a travel agent, now you do it all online from your phone. And I don't think that the healthcare industry has leveraged the technologies in the way that we could. So I'd be happy to work with you.
Great. I look forward to working with you. I thank the chairman.